Hello everyone, we are from Group 12 and today we are going to discuss about the computed tomography scanner. The topics covered are Introduction, Functionality and Suitability, Benefits, Limitations and Improvements, as well as the conclusion. Let's start with the introduction of CT scanner. Computed tomography, which is also known as CT, has made a successful revolution in enhancing the capabilities of medical imaging studies. Previously, only open surgery can provide vivid visualization of human body structure. However, after the invention of CT has given a myriad of advantages to patients in diagnosing diseases. The second one is to guide the surgery, and the third one is to make the radiation therapy process precise. According to the website of the National Institute of Biomedical Imaging and Bioengineering, the term computed tomography, which can also be mentioned as CT, is defined as a computer-aided X-ray imaging approach, where the patient will be aimed by a narrow beam of X-rays and rotated in a fast space around the patient's body. So from this picture, you can imagine that the patient will lie on the bed, and he will be moved into this circle structure called the gantry, and the X-ray will pass through his body. This action will produce signals to be processed by the machine's computer so that the cross-sectional images, formed as slices, can be generated. After the machine's computer has collected a fixed number of the tomographic images, the computer will digitally stack them together so that a 3D image of the patient can be formed, and this situation makes the clinician to easily identify the basic structures of the patients and possible tumors or abnormalities inside their bodies.
In this study, we would like to highlight the limitations which we find more significant than the other limitation. The limitation of the device can be seen when treating coronary artery diseases, which are the artifact interference and exposure to radiation.
Next, we move to the functionality and suitability of CT scanners. First, the function of the CT scanner is to diagnose cancer. Cancer is normally caused by the abnormal action of the human cells, which is called mutation, and such a condition causes the formation of tumors in the human body. Both genetic and chromosomal mutation can cause the formation of tumors. And external environmental agents, which are also known as mutagens, can cause the development of cancers since they will lead to mutations. The image produced by the CT scanner enables the clinician to recognize the location and size of the tumors, as well as the region which has been affected by the tumors. So from the picture, you can see this is the genetic mutations, and also from this picture, you can see it is the chromosomal mutations. Secondly, CT scanner can detect abnormalities in the brain. The injuries inside the brain, tumors and fluids that lead to stroke and hemorrhage can be detected using a head CT scanner. So here the picture you can see is the picture of head CT scan. The third function of the CT scanner is to image complex bone fractures, joints, and bone tumors. CT scanner can produce clear images, especially after the patient consumes the contrast dye fluids. So even small bones or their surrounding tissue are vividly visible. CT scanner can produce a wide image if the patient's bone component is not considered osteoporosis. So this is the picture which shows the bone fracture of the patient. Last but not least, the function of a CT scanner is to detect the types of heart diseases and abnormalities. So congenital heart disease can be detected by the CT scanner of the type of cardiac CT angiography. CCTA can provide a clear image of the heart, while the image can be synchronized with the electrocardiogram. So here you can see this is the CT scan of the heart. Now we move to the next part, which is CT scanner as a diagnostic device.
Alright, now we'll be looking at CT scan overcoming limitation in treatment of disease. So first, CT scan will be overcoming the diagnosis of COVID-19 and then the diagnosis of lung cancer. Let's look at the diagnosis of COVID-19. COVID-19 is caused by a virus known as SARS-CoV-2, a part of the coronavirus, and this is proved by the WHO, which is the World Health Organization. When COVID-19 first broke out in China, Wuhan, China, the first method they used to diagnose COVID-19 is using the real-time transcription polymerase chain reaction assay, which is known as the RT-PCR, and you can see that the RT-PCR machine is right there. However, this method is considered inefficient. Why? Because this method takes a long time to take each sample from each patient, and then their kit is efficiency and lack of supplies, and their laboratory setting requirements is very strict, and they give false negative results. Since the RT-PCR method is inefficient, so researchers in China, they come up with a new alternative, which is using the CT scan. As you can see the CT scanner machine right there, and this method is considered a best method because it has a better accuracy and able to detect early stage of COVID-19, able to determine size of lesion in our lungs, and then they have greater sensitivity, and lastly, they save more time compared to RT-PCR method. To look further into the diagnosis of COVID-19, we can look in this case study. Based on the study to review the effectiveness of the COVID-19 diagnostic tool, it shows that the CT scanner is preferable to detect COVID-19 compared to RT-PCR test and X-ray. And they found that there are common features in all COVID-19 patients. The first feature is ground glass opacifications, which is GGO, which you can see hazy in the image. The next one is consolidation. Lung consolidation occurs when the small air pathway in the lungs is filled by something else instead of air, such as water, blood, pus. And the last common feature is interlobular septal thickening. Next, let us look into diagnosis of lung cancer, which is one of the most prevalent cancers in the world. Patients that suspected lung cancer will be referred to the medical imaging of chest. First, they will undergo PA lateral chest X-ray, then volumetric CT scan and HR reconstruction. Even though after undergoing PA lateral chest X-ray, they get a negative result, they still need to undergo volumetric CT scan and HR reconstructions. This shows that PA lateral chest X-ray is irrelevant, which means that they have low accuracy and may lead to misdiagnosis. And on the other hand, volumetric CT scan and HR reconstruction have a more accurate and produce a more detailed image. Next, in the diagnosis of lung cancer, it needs a help of contrast to produce a very detailed image. Example of contrast is F18-fluorodeoxyglucose, and a very detailed image means that CT scanner can determine the size of tumor, the locations of tumor, and the stages of cancer. And in a case study, a patient undergo a volumetric CT scan with HR reconstructions, and the doctor will look at the size of the nodule and the size of the lymph node in the image. Why? Because most of the nodule have the same size. So when they detect a nodule that is larger than any other cells, it means that the patient has a risk of getting cancer, because a cancerous cell, they grow abnormally, which means that they become bigger than the others. And this indicates that there are tumors.
Next, we move to the limitation and improvement.
Now let's take a look at the limitations of CT scanners. The limitations of CT scanners include that CT scanners are very pricey and the cost of reparation is high. Plus, production of clear image is difficult if the patient does not consume contrast dye before taking CT scan. But today we'll be focusing on two main limitations of CT scanners, which are artifact interference that include motion artifacts and straight artifacts, as well as radiation exposure that puts patients at risk of developing malignant tumors. So now we'll be taking a look at the limitations of coronary computed tomography angiography in particular. The first one is lesser information for higher classification score. The second one is beam hardening and blooming artifacts. The third one is false diagnosis of coronary artery stenosis. The fourth one is higher heart rates influence the repeatability of blood measurement. The fifth one is motion artifacts. And the last one is poor blood image quality. Here are some of the ways to improve the limitations of CT scanners. The first one is by using image post-processing methods and iterative reconstruction algorithms. By using this method, it can inhibit the effect of intense classification on coronary artery lumen evaluation and decrease the presence of false positive coronary artery damage and blooming artifacts. The second one is by using dual source CT, also known as DSCT. The materials used to make this CT scanner is two SMA tubes and two separate arrays of detectors. The advantages of using the DSCT are that we can acquire images more quickly, better image clarity, and fewer motion artifacts. The third one is by using subtraction technology, which can eliminate interfering artifacts from calcified blood and metal stents, and also increase imaging quality. We can also use 3D virtual intravascular endoscopy, which can analyze the morphology of calcified coronary plaque. The next one is by using Gaussian sinogram, which uses prior knowledge derived from tissues classified and integrated into a Gaussian diffusion function. The next one is by using multi-slice computed tomography. The materials used to make this machine include X-rays and liquid dye to produce images of the heart and blood vessels. This technique uses a few post-processing technologies which include volume rendering, maximum intensity projection, multi-planar reconstruction, and curved planar reconstruction. Another technique is by using micro-CT, which has a spatial resolution that can reach 1 to 10 micrometers. Another alternative is by combining carbon nanotube base with micro-CT because it has a higher temporal and spatial resolution. Besides that, we can also use micro-CT with 80-fluoride sodium fluoride micro-PET CT because this method can differentiate between micro-calcification and micro-calcification. The uptake of 80-fluoride sodium fluoride can be used to calculate the calcified surface area and level of metabolic activity of calcified plaque. And lastly, we can also use phase contrast computed tomography because this method can assess and classify the component and shapes of the calcified plaque accurately, as well as detect plaque that is rich in lipid, fibrous, or calcified with high accuracy.
Hello, I am Afrida Fathima binti Barakath and I am going to talk about the limitation of CT scan, which is radiation. CT scans have 1000 times higher radiation than X-rays. This causes the patients to have high risk of tumors. Another reason why CT scans have high amount of radiation is the usage of iodized contrast media. The iodized contrast media is a need for us to detect the organs or the required images more clearly. From this bar chart, we can see that the cardiac imaging stress tests have exposes the patient to the highest amount of radiation, followed by PET or CT scan and the CT scan. Next, the improvement. Some of the improvements have been made in order to reduce the amount of radiation coming from the computed tomography. First of all is the technique in using it. Some of the techniques have been proposed by researchers that have been proved to reduce the amount of radiation coming from the CT scanners. However, these techniques have its own limitation where it costs very expensive and need more practice in using it. Other than that, in terms of materials and manufacturing, we can increase the number of detectors and speed of the gantry in the CT scanners. And also, the table that places the patient can move faster. This could reduce the time of the exposure of the patients to the CT scanner and reduce the amount of radiation received as well. Next, the usage of dual CT scanners. This CT uses two different KBP to obtain two sets of data to image the exact location of calcification. It also uses a high KEB that limit the iodine contrast. As we know, iodized contrast media contributes the most in terms of radiation. So this CT have a high KEB that could limit this contrast. However, the disadvantages is that it lacks data in the proof and need more research. Lastly, the dual source CT. This holds two X-ray tubes and two detectors that work at the same time. And the third generation DSCT can minimize radiation exposure in patients when it is combined with thin filtering. By now, we have understood that CT scanners work by utilizing an X-ray source which is rotated around the cancer. It also produces more detailed images and can produce 3D images as well. Some of the contributions of CT scanners is addressing the limitations in the diagnosis of COVID-19. It also have improved the lung cancer diagnosis and have a very quick processing time of the images, not invasive, and the most important of all, detect tumors and can detect abnormalities in brains. However, CT scanners have its limitations as well. Some of the obvious limitations are the artifact interference and the radiation. A lot of suggestions to overcome these limitations have been made by researchers, as well as doing clinical trials to prove the efficiency of the improvements. For the artifact interference, the Gaussian sinogram inflating metal artifact reduction algorithm can reduce the metal artifact effectively. Next, the multi-slice computed tomography, MSCT, can also be used as it uses various post-processing technologies that could estimate the density of flags a form of artifact. And this could reduce the amount of artifact interference in the image and produce a more accurate images after the CT scan is processed. And some also have proposed new techniques for using the CT scanners and also the improvements that can be made to the software and the hardware of the CT scan. However, it should be noted that these advancements call for expensive machineries and also a high amount of fee for the patients to pay. However, we can also be rest assured with the technological advancements these days, who knows that the CT scanners could have been improved to the highest quality possible in the future. That's all from us. Thank you.
CT scan, limitation untuk not treatment, diagnostic. Number one, it require contrast. Jadi can affect the kidney. Number two, it involve radiation. So which is not good lah. Carcinogenic can cause cancer. Dari segi better modalities or not, CT scan quite good compared to ultrasound ke apa kan. Kalau nak kata MRI better, MRI kita use untuk soft tissue. So tak ada issue lah nak kata limitation ke apa. Okay. So kalau nak cakap suggest to improve ke apa ke, mungkin you can invent something yang tak guna kontras ataupun kontras yang tak merosakkan buah pinggang, or something yang tak guna radiation. Tapi itu dah adalah macam MRI tu kita guna magnetic kan, kita tak pakai radiation.